Hey guys, I'm Dr. Mona Gohara, a board-certified dermatologist in New Haven, Connecticut. Welcome to another episode of Dear Derm, this time reporting from my house in quarantine. Today, we're going to talk about this kind of new and emerging element of medicine called teledermatology. Teledermatology is where we can still connect and still help with skin woes, but this time it's a little different, through FaceTime or a computer. But today we're going to go through a virtual teledermatology visit and talk about the pros and cons, so you know what to expect the next time you tune in to see your dermatologist. Very exciting for me is that I am actually so happy to have my producer, Allie, as my first mock patient, so we can walk you through a teledermatology visit.
So first, just to preface this, I am 100% not Mona's patient in real life. This is totally for mock purposes and to answer all of my and your questions. Let's start with the basics. I think people might be a little hesitant when they're talking about getting on a phone call. They don't know if it's private or, if it's going to be hacked into or something like that. So what are sort of the regulations around that?
All dermatologists are using HIPAA compliant platforms to conduct these visits. That means literally it's just like you are in an exam room in their office, but it's on their computer. These are private and very, very, very secure. So there is no chance that anybody except you and your doctor can see what's going on.
So what are the types of things that you're actually able to talk about and even potentially treat when it comes to teledermatology?
The most common things that we're seeing are acne flares, which are happening left and right now because of stress. And of course, we know about this new phenomenon called maskne that's happening from our essential workers wearing masks. So acne, I would say, is number 1, 2, and 3, what we're seeing on these teledermatology visits. We're also seeing flare-ups of rashes like eczema and psoriasis, which we were treating before, but now just require follow-up. And so the patient and the doctor know what's going on and know the history, but we're just kind of like fine-tuning things because we haven't had the opportunity to see each other in person. Now, some of the things that I wouldn't recommend and are much harder to diagnose on teledermatology are skin lesions. Somebody's worried about a skin cancer, they've determined a new growth or a changing mole. It really isn't ideal to be diagnosing these types of things over the computer. That definitely requires an in-office dermatology visits. Many pharmacies are really rising to the occasion right now. It's very easy for us to prescribe something, no questions asked. It takes a total of 5 minutes for us to prescribe something. The question is, how easy is it for the patient to get it, which you bring up, and that's really a great question. Many pharmacies are delivering, particularly to older populations, and frankly to everybody.
So on that note, are these teledermatology appointments covered if you do have insurance, if you are lucky enough to have insurance right now? Are these appointments being covered in the same way that in-person consultations are being treated?
That's a great question, and the answer to that, thankfully, is yes. At least in the way that we're in our office, and probably I would say the majority of dermatologists are connecting visits, they go through your insurance much like an in-office visit would. And in fact, some insurance companies and dermatologists are even waiving copays just to kind of be cognizant of the financial situation that everybody is in right now. After you make the appointment, you may often be asked to send pictures, again, through a HIPAA compliant platform that the dermatologist has, because oftentimes the resolution of pictures is much better than the resolution that you would get on the phone. So I would say, in terms of taking pictures, if you can have somebody take the pictures for you, that would be great. And there's 2 important things. 1, try and take just like a global, bigger landscape kind of picture. So if it's acne on your face, let me see your whole face, okay? so that I can understand that there's not acne everywhere. It's just that there's a couple spots. Because if I just get a picture of one acne lesion, I have no idea what's happening on the rest of the face. And then your appointment with the doctor comes. Hi, Allie. How are you today?
I'm well. How are you, Dr. Gohara?
Good. So tell me, before we get started, I want to just know a little bit about how you've been feeling. I'm going to ask you some questions. Have you had any cough or fever, chills, weight loss? Have you been sleeping well? And how's your overall health been for the past couple weeks?
So definitely no cough, fever, chills, none of those sort of symptoms. I'd say my sleep has been pretty good. I think at the beginning of quarantine, maybe not quite as much, just because I think all of our stress and anxiety levels are up a little bit. But other than that, in good health.
That's great. I'm really happy to hear that. So tell me, have there been any changes in your medications or any new allergies that you've developed?
Nope, nothing changed.
That's great, good. So what brings you in today?
So I think like a lot of people that I'm talking to, at least, I have some abnormal pimples going on. I got one really great one here for you. Some on my chin. I would say I'm generally just a little oilier than normal, breaking out a little more than I usually do. Typically, if I get a pimple, it's more of like one of those cystic hormonal kind of pimples that I get around my period. So, you know, just that quarantine stress.
Definitely. Well, you're not alone. This is happening to all of us, including myself. I just got over something like that too. So don't feel like you're unique. Has your skincare routine changed? And if it hasn't, what are you doing?
My skincare routine has not changed. My skincare routine is honestly courtesy of you, because you give the best routine advice. So I typically, in the morning, I use a gentle non-soap cleanser. Classic.
Very good.
And then I put on a hyaluronic acid, and then I use a vitamin C for protection, and I also put on a moisturizer and an SPF.
That's great. But I didn't hear in there anything that you were doing for acne. So is your
during the day?
Not okay. All right, you got me.
Oh, I'm sorry. That was just my morning routine. It's very extensive after producing.
Okay, but that's good. That's good. And that you've been doing, that is not new. So that's great.
Yes.
Okay, great. So then talk to me about anything that happens throughout the day or your nighttime routine.
I'll use a gentle non-soap cleanser again, hyaluronic acid again. Then most nights I'll use a retinol. And
great.
Since I have been breaking out a lot, I've also been trying to, you know, at least once or twice a week, when I'm not using my retinol, using an AHA-BHA blend, so an acid. And then I finish off with a moisturizer, and that's it.
Cream or lotion?
Lotion.
Okay, that's good. Because when you have oily skin, which you mentioned your skin is a little bit more oily, a lotion's better than a cream. So your basic skincare routine is great. It's perfect. Here's what I would recommend. I would recommend, based on what you're saying, we know that there's 3 different types of acne. There's whitehead, blackhead acne, which responds best to exactly what you're doing. The vitamin A derivatives, the AHAs, and the BHAs. And then there's a middle type of acne called inflammatory acne. Those are the ones that you kind of like want to pop, but you shouldn't, of course. And then there's the deeper cyst acne. You're kind of, I think, living between inflammatory acne and these cystic acne lesions right now. And so the topicals, we may have to either up the ante a little bit by adding something, and or considering a little boost of an oral medication to help. Because the more superficial the acne, then you can treat topically. The deeper the acne generally require oral medications because they're deeper in the skin, and a lot of the topicals just don't penetrate that deeply. So my recommendation would be, we have 2 options. One, you can try to get an over-the-counter benzoyl peroxide 2.5% spot treatment just to kind of follow up with at night after your retinol, just to dab it on the areas, really tiny bit, Allie, like a pea-size amount. Just dab it on the areas that you're actively breaking out in.
Okay.
Now, if that doesn't work, the next step would be a little boost with an oral antibiotic. So I would add on the benzoyl peroxide for the next spot treatment for the next week to 2 weeks. If you're like, this is still happening, then give me a call back. And I think that we should consider the addition of the oral antibiotic.
So in terms of filling up my prescriptions.
Yeah, I will get your pharmacy information and we will put that we will electronically submit that. So you should be able to pick it up whenever we put them through within a couple hours. Or we can send it to a pharmacy if you prefer that can send it directly to your house. You tell us and we'll accommodate.
Fantastic.
I standardly follow up on my acne patients in about 6 weeks. If you feel like things are not getting better, before that, the lines of communication should be open. You should always feel free to call us and talk to us. It's not going to be perfect. It may not be perfect in 6 weeks. Our gauge is for improvement. And so if you're noticing no improvement in like 3 weeks or so, we should know. But it may not be perfect at that point.
So do you think that since we've been sort of forced into this situation where appointments have to be conducted online, how do you think that this is going to push the field of dermatology forward?
I think that there's no better experience than a patient being able to interact with her dermatologist in person. I mean, nothing takes the place of that. You know, it makes for a better exam. It makes for a better, it just enhances the patient experience, the doctor experience, and is better for everybody. I mean, you just can see the skin better, things that you just couldn't dream of seeing in these virtual rooms. And so nothing's ever gonna take the place of that. I would never want teledermatology to take over for regular in-office visits, but it has its place. It's people who can't see you during the hours that you want, but still want to maintain that relationship, because once you find a dermatologist that you like and have a good relationship with, nobody wants to switch around. I mean, it's a hard relationship to find.
Thank you so much for seeing me today, Dr. Gohara. I'm definitely really excited to take your advice. And I think this all kind of put me at ease for when it comes to actually, speaking with my own dermatologist. When it does come time to maybe go back into the office, I know that there are things being put in place that are keeping you safe, keeping me safe. So I think this was a really productive virtual session.
I love it. Well, good. And thanks for joining me on another episode of Dear Derm. If you have questions, leave them in the comments below, and don't forget to subscribe to Well+Good. Hopefully we'll see you in person soon.